Hello everyone, I am Dr. Parvez Ahmad. Today I am going to talk about the drugs used in diabetes mellitus. Okay. Before starting the pharmacology, first discuss about the basic thing of the diabetes mellitus. What do you mean by diabetes mellitus? Diabetes mellitus, that means the increase the blood glucose level. Generally 100 to 200 milligram per deciliter blood glucose level we consider as a normal. We have no need to use the drug. In that case, we modify the lifestyle of the patient, and dietary control is the primary treatment of diabetes mellitus. If blood glucose level is greater than 200 milligram per deciliter, then we have required to medications. Okay. Now we know that different type of diabetes mellitus. First one is called type 1 diabetes mellitus. Type 1 diabetes mellitus. Type 1 diabetes mellitus. That means the in case of the type 1 diabetes mellitus, complete destruction of beta cell of the pancreas. Okay. And type 1 diabetes mellitus is also called insulin dependent diabetes mellitus, that is the IDDM. Now, second type of the diabetes mellitus is called type 2 diabetes mellitus. Okay. In type 2 diabetes mellitus, that is the resistance is developed towards the insulin. Okay. Now, third type of the diabetes mellitus is called type 3 diabetes mellitus. Generally, these occurs because of pancreatectomy, maybe pancreatitis, and maybe use of the drug like corticosteroid may cause type 3 type of diabetes mellitus. Now, type 4 type of diabetes mellitus is called gestational diabetes mellitus. That is the abnormal in a glucose level during the pregnancy. Okay. So, the drugs we have used in case of type 2 diabetes mellitus is called oral hypoglycemic agent and insulin secretase. Okay. So, today we have discussed here oral hypoglycemic agent. What the mean by oral hypoglycemic agent? That means that these are drugs which reduce the blood glucose level and effective orally, that is called oral hypoglycemic agents. Okay. Now, oral hypoglycemic agent nowadays divided into different types. Now, first one is called insulin secretion enhancer. These are the clear from the name, the drugs which enhance the secretion of insulin. In this category, first very important drugs are sulfonyl urea. In sulfonyl urea have a different generation. First one is the first generation. Okay. Now, first generation of sulfonyl ureas like chlorpromamide, tolbutamide like drugs not used nowadays. Now, second generation of sulfonyl ureas examples are first one glibenclamide. Okay. Now, next one glimepride. Next one gliclazide, and this gliclazide have a additional antiplatelets property. So, these all are the examples of second generation sulfonyl urea oral hypoglycemic agents. Okay. And these are drugs nowadays widely used in case of type 2 diabetes mellitus. Now, the second category of the drug is called phenylalanine analog or biglinides, okay, like repaglinide and netaglinide, okay. RN, R stand for repaglinide and N stand for netaglinides, okay. Now, third categories of the drugs in these categories are glucagon like peptide receptor agonist and also called incretin mimetics, okay. Basically, these are the example of gastrointestinal hormone. These are drugs which enhance the insulin secretion and suppress the glucagon, okay. That is why I have used like exenatide, liraglutide, okay. Now, next category of the drug is called DPP4 inhibitor, that means the dipeptyl peptidase 4 inhibitors. Basically, dipeptyl peptidase are enzyme which are responsible for breakdown or cleavage of GLP-1. So, now here we have used the drugs like sitagliptin which inhibit the DPP4 and increase the life of incretin like sitagliptin, okay. Now, next one is the next category of oral hypoglycemic agent is called overcome of insulin resistance. That means, these are drugs which overcome the insulin resistance and also called insulin sensitizer. First one is called biguanide derivative and single drug and very effective drug nowadays available metformin, okay. Metformin generally we have used 500 milligram and 1000 milligram, okay. Now, next category is a thiazolidine dione derivative. These are also example of insulin sensitizer like pioglitazone and rosiglitazone. But this categories of the drug not used in case of those patients who have a risk of congestive heart failure because it causes edema. Now, after the second category, now move to the next category, that is called miscellaneous categories of the oral hypoglycemic agents, okay. Okay, now first one in miscellaneous categories are SGL2 inhibitors, that means the sodium glucose co-transport 2 inhibitors, okay. Examples are gliflozin, suffix is a gliflozin like canagliflozin, okay. Dapagliflozin, these are the example of SGLT2 inhibitors. Basically, these are drugs which inhibit the reabsorption of glucose in the kidney and resulting glucose is excreted through the urine. But one of the major drawback of the SGLT2 inhibitor is it may causes urinary tract infection. If you prescribe these categories of the drug, you have instruct to the patient to take the penalty of water to minimize the urinary tract infections. Now, next categories of the drug of in miscellaneous categories are alpha glucosidase inhibitor like acarbose. That means these are drugs which are responsible for metabolism of the carbohydrate, okay. So, these are drugs which inhibit the metabolism of the carbohydrate. Acarbose, miglitol like drug we have used. Now, next one is the amylin analog. Example is pramlintide, okay. D2 receptor agonist like bromocriptine. Bile acid binding regimens, example is a colesevelam, okay. And basically, these are drugs which have used in case of hyperlipidemia, but here also we have used basically amylin analog, D2 receptor antagonist and bile acid binding resins, these adducts we have used as adjuvant in a case of the diabetes mellitus. Okay, thank you all of you. देखिए लंबा हो गया क्या बेटा?